Hey listeners, it's just Editing Sam coming in just to let you know that this episode we talk a lot about COVID-19 and different reactions and different approaches to managing COVID-19 and some of the truly horrible things that has happened over the past 2 years. If that's something that might be a bit distressing for you at this moment, I totally understand if you don't want to sit down and listen to this episode. That's totally fine. Feel free to come back to it when you're feeling in the right headspace, or just don't come back and listen to it at all. I don't mind. It's your choice, and I totally respect whatever decision you make. In regards to you coming and listening to this episode. Thank you so much for your support, and I'll see you on the next episode.
That movie sucked.
I kind of liked it.
Movie Night Crew Network.
Hello and welcome to Content and Capable, where I try to figure out what it really means to adult. Today I spoke to Alex from My Cabbages all about her work in public health, how she got into it, and where she wants to go in the future, as well as some cool anecdotes from the past 18 months. Welcome to Content and Capable, Alex. It's lovely to have you on.
Thank you so much, Sam. I am so happy to be here.
Yeah, I'm really excited because we've kind of touched on this topic, a couple of times over the past few months. Every now and then I make a joke or a comment about healthcare systems and it always brings up this weird conversation because I do live in Australia and my health system is completely different to yours.
Oh, you mean functional and actually serves the public versus private individuals?
Debatable, but yes. But yes, no, it's very interesting because I'm always fascinated to see how other people live, and health seems to be one of those things, especially a very adult thing that we have to always be discussing and thinking about.
Absolutely.
And
more than I probably should.
Yeah, it definitely. I'm really lucky. I am on what's called a healthcare card, so we have a Medicare system. It's a little bit similar to the systems that people propose in the US. But dental is covered only if you have this thing called a healthcare card. And I've got one of those healthcare cards because I'm on a specific type of benefit from the government that means that I'm allowed to be on it. I then can go on to go and see a dentist free of charge. Except the line is 2 years long.
Okay.
Which is just interesting. There's different aspects to there are pros and cons of, I suppose, a private system and a public system.
Absolutely.
But to bring things back to the start, how did you get into working in healthcare?
Yeah, so I have always had a fascination with medicine and health and weird diseases. And so before I went to university to get my master's in public health, I had to write an essay. I'm pretty sure everyone has to. I think that's a universal, not just a US thing.
Yeah.
Wrote a personal essay about what were those formative moments that throughout your life that made you want to pursue a master's, and what are you going to do with it? So I have a good response for this. So I always like to joke. I knew I was going to end up working in something tangentially health related when in third grade, our class had to do a project on the medieval or the Renaissance period. And all of the girls, did feast and fashion and courtly manners or, some history or some type of event. Whereas the guys were always, I'm going to do knights or warfare or something more political based. And here I was I'm going to do the Black Death naturally. I mean, what other? So I was always fascinated with probably a little things too morbid for the general public. But and then I just had a lot of interest in books and different things growing up. And there was a girl that I actually babysat for growing up who was born actually with a congenital heart defect. She was born with a hole in the wall of her heart. And before the age of 2, she had to have several open heart surgeries, and just seeing how resilient this child was is like, you know, you wouldn't tell by any time except that she has a, you know, scar like that you see on her heart, but other than that she's just like any other kid. And now like she's going to my alma mater and pursuing a degree in nursing, so I don't know, I guess it just runs along. But for my project, like growing up, I got to see her, and I was in Girl Scouts and did a project where I made pillows for children coming out of open heart surgery. And so yeah, it just was kind of a natural path. But the person that I really think that changed and gave a name for all of these interests that I had growing up, I got to go to a program and hear a man by the name of Paul Farmer speak. He's pretty prominent in the world of public health, and will definitely be a plug for me on this episode. But he is a graduate of Harvard Medical School and founder of Partners in Health, which is a nonprofit who started in Haiti and now have several clinics around the world where beyond just going in and providing healthcare, they actually help break the poverty cycle and believe that like in order, it's not just about treating the problem, it's about how can we embolden and build the capacity of this community to treat root causes of the things that are causing people to get sick in the first place. And, you know, he was like, this is what public health is. It's looking at the ecosystem in which people live that influence their day-to-day decisions. And for people that live in countries where they don't have regular access to healthcare, it's more than just that. So hearing him talk really got me interested. And now I went to school and here I am, and I work for, you know, the state government where I live, and for our Department of Health, and I'm very excited to be in the position that I am today.
Yeah, that's amazing. So, like, obviously, public health is a huge, like, kind of aspect to, you know, our health system. What does public health entail?
Yeah, that's a great question. So, you know, and especially here, at least in the US, when people think of healthcare, they think of, you know, that's when I go to my doctor. I mean, you described your medical card. For here in the US, people have similar things when you buy insurance, whether it's through, you know, an employer, like the person you work for, they provide health plans, or some through the government. You know, it's a mostly private, but sometimes public. And so that's what we think of traditionally, is I go to the doctor when I'm sick, and that's kind of what my health is. But public health takes that individual relationship between a person and whether it's their doctor or some type of medical provider, and blows it up to the macro level where you're looking at health of entire populations. So while medicine and doctors, they traditionally focus on health of individuals, public health is about the health of populations. So you're looking at programs or interventions or types of education or media campaigns that are going to have an impact at something beyond just the individual level. So that can be as small as a community or like a neighborhood, or as large as, you know, an entire state or country. So there's a lot of, like, it's a question of scale, but also the things that you're doing to improve the health of whatever group or population you're working with.
Awesome. And, you know, obviously we've been speaking a lot about public health, and I think a lot more people are aware of it nowadays because of, you know, the last 12 months.
Living in a global pandemic will do that, yes.
Yeah. And, like, so did you have much involvement of that, or were you more involved in other public health aspects?
Yeah, that's a great question. So I will speak from my experience here in the United States, and I want to say that because I know the experience that we've had in this country compared to others has been, you know, very different. And so, for example, I think here in the US, most people at this point, depending on your age and some of your health conditions, have had at least the opportunity to get a vaccine for COVID. Whereas in a lot of other places, even in, you know, modernized or developed countries like Europe, Australia, I don't know if it's the same. But for me,
yeah.
But for me at least, I started, like, my background is working in behavioral and community health sciences. I worked in academia for a little bit, running various, grant programs. And so I was very administrative based, but at my core, what I love is being able to work in communities, like whether for nonprofits or different community groups that are actually providing services to the people that live there. And so whether it's, a food bank or some type of STD clinic or a STI clinic serving people that don't have health insurance, that's kind of what I really enjoy. So I was working in that type of background or area before COVID. And I, of course, like with a lot of other things, unfortunately, public health is not as well funded in the United States as other countries. And so even though, like, we have, like, the Centers for Disease Control and Prevention, or the CDC, which is, like, the world leading organization besides probably the World Health Organization, we weren't necessarily prepared. Like, we didn't have the workforce or the infrastructure to really respond, like, in an immediate way. So it took time to build, like, these systems in order to respond to the crisis. We were in emergency mode. Like, I remember even back in, like, March of 2020, like, we were still scrambling for weeks and months to get tests out, to see tests, like, where even in the community COVID was spreading. So me, like many other people, even though I have a background in working in community-based healthcare or like behavioral health, we were pulled onto the front lines. So I've been doing stuff with vaccine rollout where I live. And so, yeah, that's something that I have a lot of respect for. And I'm even lucky I still get to work from home, whereas a lot of colleagues and friends, they're, like, out there in the trenches working every day besides doctors and patients, and really, like, having to just uproot their normal lives and have just been in response mode ever since the pandemic started. So
yeah, it definitely turned a lot of people's lives, you wouldn't expect, kind of upside down. I don't know whether I've shared this story on the podcast, but at the start of the pandemic, my father ran basically the, like, border control force here in Queensland. For 9 months, he ran the military aspect of that operation. And he sat us down before he went, about 3 or 4 days before he officially got deployed. He sat us down and he said, this is bad. Like, this is going to be, like, a real struggle. And there are going to be a lot of people who are hurting from this. And he goes, I do not know what's going to happen. And it was terrifying.
Oh, that's so scary.
And so many people were, and like, as you said, you work in a bit more on the other aspect, not like these kind of pandemic aspects. And it is terrifying to have at some stage be told, we don't know what the future's going to be like.
Yeah, I can't even imagine, having to deal with that. And, like, your dad is definitely one of those people, like I mentioned, that's on the front lines. And something about a pandemic, even though it's, traditionally relegated to public health and disease experts or epidemiologists, pathologists, all of these IST who go off to have these fancy degrees to study these things. One thing about a pandemic is it doesn't know borders, mean nothing. Your background means nothing. It's literally impacted everyone and everything. That's why it's called a pandemic. It's literally a disease outbreak that's felt on a global scale. And when we're looking at some of these, there's been a lot of comparisons between the COVID-19 pandemic and the Spanish flu outbreak of, 1918, like after World War II, which a lot of people don't know, but the Spanish flu, or I would actually try to stay away from, using names of countries. So like the flu outbreak that happened back in that time killed more people than the World War I did in warfare. And so I think that people just weren't prepared for how big. And I remember when I was listening to the radio, again, even though I don't work in infectious disease. I work on more of the chronic disease or prevention side of public health, trying to prevent public health problems before they get to the crisis that is a pandemic. I was listening to the radio and thinking of like this disease that we didn't know of that was making people sick over in Asia. And it's just really, I was always that voice in my head, and it's like, no, it's not going to reach that scale. And here we are, and it's like the Kennedy assassination. Everyone kind of knows where they were when they first went into quarantine or got that message of like, wow, this is real.
Yeah, it's very interesting, and it's very interesting you talk about how you heard about this random virus going through Asia. It's because where I live geographically is quite close to, China and Asia. We had exchanges that were happening, or people going on school trips and things. It was terrifying. And we're hearing about this. We were hearing about it about New Year's. And we're going, oh, what is this thing that's happening? And I think it's something that, from a place of privilege, we think, no, we're not going to get this. It's not going to come here. It's not going to,
Absolutely.
turn our lives upside down. And then it does. And it was kind of devastating.
Yeah. And it's, it's not just, it's it felt in every aspect, people that aren't in public health, whether it's looking at it from an economic perspective or a social perspective, kids and their mental health, being out of school, and families not being able to be together, or people can't travel, like, and even culturally. And like now just seeing like, I go everywhere with a mask, even though I'm vaccinated. I always, and it's not necessarily to keep myself sick, it's to protect other people, because even though I am vaccinated, I can still like pass along or be asymptomatic, and depending how long it's been since I received my booster or my vaccine, I could infect other people. So just seeing how culturally things have changed, because where beforehand, I wouldn't have, if you had asked, oh, wearing a mask out in public, I'm like, that would never happen. And it's I think it's being from a place of privilege. I get to work from home still. I have healthcare, whereas like, here, in the US, and yes, we could debate about wait times and things like that, but I still know that like there are people who have to make decisions in our country of like, am I going to, go and fill this prescription at the pharmacy, or am I gonna like put food on the table? Like, so the cost of healthcare is, it's still inaccessible. Like there's people that, will never have access or like get to be put on a wait list. So, but just seeing how it's, affected daily life has been definitely hard. And for everyone, no matter where you live, it's just in different ways, and depending on, what resources and where you live and what resources you have access to has, and that's something that, I try and think of all the time is, looking at especially when I'm looking at the vaccine, for example, like, how are we going to get this out equitably to make sure everyone has access to it? Because, whether it's transportation or cost, people are being hit disproportionately by this that is out of their control in some cases.
Yeah. And look, we could talk about COVID all day.
Right.
I think that, and I definitely don't want to speak about it all the time, because, otherwise this would just be the COVID podcast.
Yes, there was a life, and there will be a life before and after COVID.
Yeah. And I suppose then, like, have you pivoted back to quote unquote normal life, or are you still going through working with those COVID responses?
Oh, that's a great question. So I've actually, it's been almost or over a year since I've been, in a different position, like working on COVID things and also other public health things. But, things are slowly starting to get back to what, quote, people would say normal. I don't think we'll ever have, go back to the way things used to be. I'm, again, always going to wear a mask where I go, and I'm able to, I don't work from home all the time now. I go back into the office once a week. I know people that have gone back full time. And so, yeah, I think things slowly are starting to get there. But there are things that I didn't do before this pandemic that I will. And I also has changed like how I think about certain things and, you know, those decisions you make day to day. And I'm sure, you know, other people, I'm not just the only one that has, and even within the United States, you know, we're just like Australia, we're a very big country, and there are people that, you know, still like for them, like things never changed. They kept having to go to work every day. They still had to like take their kids and find, you know, a place, childcare for them. And so, whether or not that has changed for everyone or has gone back to a normal is relative. But yeah, and so I'm slowly enjoying getting back to like talking about things that are not COVID at work. That's nice. And getting to the idea of spending the holidays with family. You know, my brother just got married, and I know so many weddings that were canceled because of COVID. So yeah, it's nice to start slowly getting back out there. And I really hope that like as more people get vaccinated, that will just continue in that direction. How about you?
Yeah.
How have things like, because every time, like every few months, I feel like things are starting to get on track, and then you send another message being like, oh, we're under quarantine again. So how are things on your end?
It's very interesting because the approach because like America, we've got states, so, you know, or governments underneath like the big umbrella of the government. And it's very interesting. We're having a very interesting debate at the moment as to how we should approach opening up the country because we're at that stage where we're hitting these vaccination targets. In fact, the ACT has become the most vaccinated state, if you compare it to even the US as well, the most vaccinated state in compared to the Australia and the US. We're at like 95% vaxxed there. So it's just Doug from accounting that hasn't been vaccinated. It's great.
Yeah. I will say this, my state, like we are in the top in terms of states and having the proportion. I think when I checked earlier today, we're almost at 90% of adults over the age of 18 that have received at least their first dose of a vaccine. But 95 is pretty incredible. Also considering we've been vaccinating since January of 2020 of this year. Yeah. And you all were I think several months behind that.
Well, yeah, it was interesting because I was speaking to a journalism professor, it would have been almost 6 months ago now, and we're talking about it because the vaccine rollout was really just starting to get feet there. We had a really bad outbreak in New South Wales and in Victoria, which meant that like the only real way to get out of that outbreak, and according to one of our premier, who's like the equivalent of like the lieutenant governor, or the governor of that state, one of them was like, yeah, we're not going to try to go back to 0 cases. We're just going to vaccinate our way out of this. And the other premier turned around and goes, no, I want to do it, you know, you have 0 cases. And he had to fold. And so they got really onto the vaccination. But I was talking to a professor, and I'm talking about, you know, why our vaccine wasn't coming as fast as we were hoping and expecting it to. And it was interesting because it wasn't like we got angry at our government, but it wasn't necessarily our fault. It was they got stuck in Europe because Europe saw how well we were doing with the COVID and how low our case numbers were, even though, you know, the majority of the population was in lockdown at many stages, and they saw how well we were doing. They're like, well, you don't need the vaccine yet.
No.
I was like, that's not how it works. You know, this is a commercial agreement, not not necessarily
how you feel today.
Yeah. I was just like, and, you know, that kind of started our issues. And I'm really lucky. I live in quite a warm state. And I also, you know, live in a state that has been really good at following rules.
Yeah.
Not to say that there aren't people who disagree and there aren't people who don't follow the rules. But it's very interesting because, you know, we are now getting vaccinated and we're getting to that point where, you know, I think the whole of the country is set to hit 80% double vaccinated in 2 weeks' time.
That just for Queensland, or is that for all of Australia?
All of Australia,
What?
and that's over the age of 16.
Wow, that's incredible. It's taken us 11 months, and we as a country, because there's so much variability. Yeah. My state's doing very well, but there are parts of my state, or even like parts of the US, that are nowhere close to that. That's amazing.
It's very interesting though, because the comment I heard from someone was because your culture is quite fragmented, because you've got a lot of different aspects and quite strong aspects to your culture. You think about, that whole French area of the South, New Orleans and things like that. And then you've got the West and, your California kind of lifestyle, and then the Midwest, and then, the East Coast as well, especially the Northeast.
Yes.
And you've got like these different segments that have very different cultures, whereas here in Australia, I think because we're a little bit more homogenized, not to say we aren't multicultural, but we're a little bit more homogenized, we kind of understood what was happening. And because I think our lockdowns were a lot more harsh and a lot longer, we also understood that if we did this, we would be less likely to be thrown into, a lockdown with 4 hours notice, which has happened many times.
Yeah, I feel like there are parts of, it's not just, I feel like certain parts of the country, I feel any US city, if you had to go into like mandatory lockdown, like after a certain, like just on a whim, like even after like we'd already been under one, like people just wouldn't do it. It's very interesting to see how like you describe it as homogenous, and I think there's a lot of reasons for it, but that you would not, like, even if that's why like you never saw like a mask mandate, like never became something that was universally done. Doesn't matter who the president is. I just think there's so many people in this country that we're just so big that this is like, you can't make people do something. So it's or at least without a challenge, or like the threat of like some type of civil or criminal penalty, and that's not something that would just never have happened or worked here.
What I also find fascinating is the way that like who's in charge of what. So the way our governments are set up is very different as well. Our state is very much in charge of the police. So, as soon as, they want to make a ruling, the police enforce it straight away, because that they've got that really, really close relationship. Whereas I know that a lot of police departments in America are running like county divisions.
Yeah, it goes all the way down to like the local level, and even states do something. That's why, people look at the 1970s as like the period where all these like mass murders, or not mass murders, but serial killers came about. And they're like, that's like, it's just like, and you look at what was happening in the 70s, there was a great time of civil unrest. We were just coming through the civil rights movement and the Vietnam War. And it's just like, they're like, oh, there was like so much happening in his city. It was like, well, actually, like, there's probably always been serial killers or, people that have committed crimes. But because different states, or even like people that live across like a county line, are doing things so differently, they never talked to one another. There weren't systems set up where they're like, well, we had this crime happen, or we had this thing happen at a certain amount of time. You couldn't find patterns. And it was just then that's when they really started setting up like databases and like protocols for how these things happen. And now, like, once something crosses county lines, the Federal Bureau of Investigation, or the FBI, gets involved. But still, there's still a lot of gaps, and it's not perfect. But yeah, it's interesting to see those differences.
Yeah, it was interesting. My father told a story. So here in Brisbane, it was actually best exemplified by a comedy show I went and saw on Sunday night. But it we've got this divide between the north and south side of the city.
Okay.
Because the city's split basically by the river in half, and pretty much 50% live on the north side, 50% live on the south side. And it's basically a crime to like have a relationship with someone who lives on the other side of the city from you. Like it is just really culturally, like there is a huge divide. And my father turned around while he was running COVID and goes, that divide goes all the way to the government in terms of our health system is split into like districts, and each district will run the hospitals. And he's tried to get Metro North and Metro South Health together to like agree on testing protocols and procedures for international arrivals, because they were taking, international arrivals into hotels all around, the CBD, so on the north and the south side. And they got in the room together and immediately started fighting.
Oh, no!
And it was just like, never could agree on anything. And you can, I definitely think that, as soon as you start dividing things up, it's like an us versus them approach.
Yeah, absolutely. It sounds, honestly, I'm not sure if you're a fan of Parks and Recreation, but it's one of my favorite shows of all time. Leslie Knope is my spirit sister, and I just see her in town hall meetings, and the rivalry between Pawnee and Eagleton is kind of like what you're describing here to me.
It's great because like we will get together and like slam people who hate on Brisbane, but we'll hate each other through the whole meantime. It is just like we'll make self-deprecating jokes. Like one of the jokes in this comedy show I went and saw was like, well, if people want to drink beer underneath the Story Bridge, which is one of our iconic landmarks, well, they can drink it underneath the Gateway Bridge, which is this huge bridge that goes over the mouth of the river, and it's like the big highway, but it's on mud flats, so the whole place stinks. So like we'll make self-deprecating jokes about different aspects and things like the 5-year cultural delay of Brisbane, but at the same time as soon as like Sydney or Melbourne starts talking smack about us, or
everyone comes together and they're like, no.
We got really offended when like they announced the Olympics and people going, what the hell is Brisbane? And when people pronounce Brisbane wrong, because it's spelt Brisbane. Yeah, but we pronounce it Brisbane, and it's just, it's so fascinating because that doesn't just, isn't just a cultural thing. It then transfers to, things like public health and, communication and, policy that is made as well.
That is such a, I think that's a great analogy and a great place to kind of bring it back to, because public health is just like with anything else, right? Is so much about where you live. And, there have been certain like aspects of this conversation by their nature. Public health is, because you are looking at the health of like multiple individuals versus just one, you are ultimately going to have to make decisions that impact people potentially negatively, or you'll have to sacrifice into what some would see as sacrificing individual liberties. Like before COVID, we had I wouldn't say argument, but the debate about whether getting your child vaccinated should be a requirement to go to school. And, there are certain groups, whether it's because they belong to a certain religious group or their child has certain medical conditions, they're immunocompromised and can't get vaccinated. They rely on other people making good decisions, acting for the greater good, in order to be able to go to school. So that's like that concept of herd immunity, right? Yeah. So even if you as an individual choose to get vaccinated, there have to be a certain people that buy into that collective idea in order for it to have that benefit. So other people who cannot get vaccinated can like still go out and have a healthy or quote normal life, because the other people in their community or whatever population they live in have done that. And I think at the end of the day that is something I think, like to do well, or that we do well. It certainly has changed over time, both in the United States and around the world. But out of times of crisis do come adversity. And I think that in the long run, we're all going to be better people because of this. So,
yeah. What are some of the strategies that you guys use in public health to, get people to do things that they might be hesitant on, or they're not sure, or like even just educating people as well?
Yeah, that's a great question, and unfortunately not an easy one. But and it depends on what part of public health you're in. There's like a really good analogy that I like to think of, and because whether it's you're trying to have an individual conversation with a community member or a client that you're serving through a program you've set up, or a policymaker who you're trying to educate on a specific issue that you care about, you have to make that person see how it's personal to themselves, and that at the end of the day, all I can do as a person in public health is to give people the information that I know is credible and that comes from an reliable source, and then help them see the potential consequences of if I do this thing or if I don't do this thing, and then leave it up to them to make that decision. So my job, and I know that I've done a good job at the end of the day, is if I've given that person enough information for them to feel like they have made a decision that is beneficial to them and their health. And public health is hard because so much, when we're in COVID, we're constantly in reaction mode, right? We're looking at how can we get the cases and the number of infection rate down, or how can we increase the number of people getting vaccinated. We're always kind of reacting to data that usually is probably dated, or it's definitely not real time or as close as we can get to it. But a huge part of the public health that is behind the curtain that people don't see is prevention. So we're not trying to react to problems in the grand scheme of things. We're trying to prevent them from even happening. And so then that can be talking about days, weeks, or even years in advance, and trying to get people to think far in advance. Look at climate issues like climate change, right? We see things and we make decisions day to day because we're oh, well, it's not that bad now, but we're not talking about now, we're talking about years, or our children. And so trying to make that connection between things and actions that I take now as an individual, what I'm eating, my physical activity, the social activities I engage in, those day-to-day decisions that are going to have an impact on my health, a year or even sometimes decades from now, right? Is really hard to wrap your mind around. So it's all about just trying to meet people where they are. Whether it's trying to talk to an individual or a community member about, or an organization about engaging in a certain behavior that's going to, with the idea of improving their health or making an issue lean towards a beneficial direction. You just have to say, here are the potential impacts of this thing, and talk to them. You don't want to come in as an expert saying, I have all the answers. Here I am. I know what's best for you. I've studied this. I'm an expert. Trust me. It's ultimately just a series of conversations and meeting people where they are, saying, hey, what is your day-to-day experience like? What does, the things that you try and do, or what are the things that you can't do? What is important to you as a person, as a community? And then working together, finding that common ground of okay, here are the tools I have in my public health toolbox, and what are the things in your community that are things that you value and want to fix, and how can we meet in the middle to make that come together. Because, for example, like I work in, tobacco control, and trying to tell people to stop smoking. Like, people know smoking's bad for them. They know that it's something that they shouldn't do. It's expensive. It's bad for their health. They may even had family members that passed away because of the health consequences of smoking. However, getting them to change that behavior is really hard. So and no one's going to change by telling them, well, if you just keep doing that, you're going to die. It's just, meeting people and presenting them with information and like making small changes over time that then ultimately have that bigger impact. So I know, sorry that was long, but like there's no easy answer, but it's all about seeing like we're all human at the end of the day, and presenting and giving information in a way that's relatable, and making people feel that because at the end of they're experts too. They know what's best for themselves or what their experience is, and meeting in the middle to make some type of change is really what public health is about.
Yeah, it's very interesting you mention, those kinds of preventative measures, because the last 2 years we've seen very reactionary because it has been so unpredictable. Kind of pivoting from that, what has been your favorite project that you've worked on so far?
Oh, that's a great question. I would have to say, when I was in graduate school, I've really enjoyed the work that I did working with refugees. Like, the city that I went to school in was a very diverse city. It was, very large, fairly progressive. Like most, I would say most cities are in the US, like, or in urban settings. And so we were very, I like to think, welcoming of outside groups. And so when I was in graduate school, I was working with like a local health clinic who saw a lot of refugees, because when they first come here, they and one thing that's different about refugees than people that migrate to a country is like they are leaving like without the choice, that agency or decision to choose to leave their country is something that clearly defines or separates someone who's migrating versus who's coming as a refugee, and they usually don't have a decision of where they go. And so there's a lot of usually trauma involved in whether it's the things that are causing them to leave or like the process itself. There's usually like a time when they spend it at a refugee camp, maybe in a third country. And so I was really endeared to the work that I did working with people that came to America without like the choice. They left behind family and friends, like some may have even died, or then but the types of things people went through were just horrible. But then you hear them still talk about how much hope that they still have and how thankful they are to still be here, and how I get like, I'm like, people aren't nice. Like, the guy on the bus like yelled at me for looking at him weird or whatever, and like are cutting him off in traffic. And here you are saying how everyone has been so nice and welcoming. And I know that's not a universal experience. And I'm also like, I'm at my core also an anthropologist. So I know when I'm in a role of being a researcher, when I'm going in and I'm talking to people who, like that power dynamic is something you have to be aware of. So I know that there's definitely probably things that they said to me that they would not have said to others. But the work I really got to do with just getting them, access to healthcare and, hearing their experiences and their stories and like learning from each other. I think that's one of my favorite things about public health. I learn new things every day. And so, and it's usually in very unexpected ways. And it's not always from reading a book or watching some type of, video It's by learning from people and
Yeah.
the small world that, you know, we live in. I know it seems really big, but we're all connected. And so it's really gratifying seeing how no matter where people come from, we can always find something that grounds us together and moves us,
Yeah.
hopefully moves us forward together.
Yeah, it's always amazing, and I really appreciate the people who work in public health, all the work that they do, because as you said, they're not just thinking and reacting to what's happening now. You know, they're preempting things. They're trying to, you know, make really positive changes, and when those changes are made, we actually don't really hear about, you know, the amount of work that's gone behind it and the amazing work that you guys have done in the background. So I really appreciate the work that you do.
Oh, well, thank you, Sam. That means a lot. And, you know, I'm also thankful for, you know, people like you who want to sit and talk to us about it. Because so many times, you know, you talk to people about what public health is. And, you know, it doesn't matter if people really, truly know. Like, people don't realize how in everyday life public health has touched them. When people think about it, they think of pandemics or just like these huge like diseases that have like, you know, killed like so many people or have caused so much pain or like, because those are the things that, you know, that make headlines or make for an interesting story. But to me, the most public health thing is, you know, sewage and antibiotics and access to clean water, or like those are things that, you know, really are what make a difference in, you know, your quality of life. And so I'm recognized where I live, and like I'm very privileged to have the ability to go and turn on a faucet and water comes out. And where it's like those things that are like sometimes are mostly out of our control, that really have such a big impact on our health and our well-being. And so just bringing that together, and, you know, seems sometimes like unsolvable problems, but when you break them down to their core and bring people together, I think one of my favorite quotes of all time is by Margaret Mead, and it's like, you know, don't doubt that a single person can change the world, for in fact it's the only thing, you know, that ever really has. So everyone has power, but when we come together, it's like, you know, even more powerful. It's exponential.
Yeah. You're making me tear up at this point.
I'm sorry, I really love my job. And I love people.
But, you mentioned the water faucet, and all I could think of was, I know I'm in a place of privilege when I complain about how different cities' water taste. And it's terrible.
No,
yeah, when we go to Adelaide, which is in South Australia, I think that they use bore water. Anyway, their water is a little bit, it tastes different. It's a bit harder. And like it, to us in Queensland, who have like real fresh water from dams, you know, less than half an hour's drive away, it tastes disgusting. And we complain about it incessantly. In fact, I vividly remember we drove down to Adelaide, so it's about a 5-day drive.
Oh, wow.
And we drove down there, and then Dad filled up the water jerry cans, and we refused to drink out of them for the whole trip back. And we brought this Adelaide water back up to Brisbane and then promptly poured it out onto the grass to water the grass.
Well, you know what? You were still recycling. Like plants, I'm sure that they still were useful, like are grateful for that water. And
but like, just like a complete place of privilege where, admittedly, I was a child at the time, but just, don't want to drink the water, not going to drink the water.
Yeah, I mean, when I travel within different parts, because, you know, it's easy for us. You live in Australia, I live in the US, for us to compare countries. But like you're saying, even within your country, like between different places, there's these different experiences. And just in the US, like I know like there are parts of the United States that are like, you know, sometimes even like some of the amongst the poorest places in the impoverished areas in the world. And, you know, it's just comes from like decades, if not centuries, usually of, you know, social inequity and, like, you know, laws that will bake like systemic and organized institutional racism. Like those are things that have real lived impacts. And so like they're like, you know, parts of the South where people don't have access to running water or to healthcare. You know, if a woman wants to get you know, access to some like to reproductive services, like she has to sometimes like take off work and take an entire day just to drive across state lines because there's not. It's just crazy to think, you know, even though we're talking about the globe, even like close within where we live, there's these inequities which we try and work every day to fight, but you know, it's something that's going to take a long time, and unfortunately if there were no conflict or problems in the world, I'd be out of a job. So
it's like it's the same as with journalism, really. Like my job just thrives on conflict. I'm like, if people are fighting, I've got a job. So what does the future look like? Where do you want to be, I don't know, 5-10 years time?
That's a great question.
And what kinds of projects do you want to be working on in that period of time?
Yeah. Well, you know, life changes, and what I thought I wanted 5 years ago is completely different, you know, than where I have ended up. So I'm sure this will change. I'm interested to see how it is in the future, but ideally, I would like to go back to school. I want to pursue a doctoral degree. I'm really interested in policy and, like I mentioned, my love for Leslie Knope and Parks and Rec. And, you know, there's very, like, that's one thing I love about public health. It's such a diverse field. So even though I'm, like, working with communities and focusing on, you know, making, you know, behavior changes, like there's like the epidemiologists who are looking at, you know, disease trends, and they're the ones calculating all those numbers, looking at how like those graphs are going to look with different diseases and how these different interventions may change things. And there's biostatisticians who do even more math, and I'm really become interested in the policy side. So I really like working with the legislative system and seeing, you know, how can, you know, we better educate lawmakers, but ultimately how can we empower individuals? So many people don't realize. This is one thing I'm very jealous about in Australia, where like people, like it's a law, you have to vote. Whereas here voting is just like another thing that is so varied here in the US. So like I love the idea of like helping people realize that they are the ones that are ultimately going to, there's a problem in their community, like how can they speak up and like take power and build coalitions to then like, you know, grow outside into like an even larger at the regional or statewide or national scale and really empower individuals to take issues that impact their day-to-day lives and you know, make a change for good. And so I'd like to think that I can play, whether it's on the education side or, you know, even like, you know, litigating on like potentially becoming like a lawyer. Like, I know that sounds crazy, and I'm definitely in 5 years being a lawyer is probably not where, but it's an idea that's crossed my mind. So I don't care what the project is. There's a lot of different topics and things that interest me. Ultimately, I just want to be, you know, making a difference and again continuing to learn new things every day.
Yeah, that's awesome. I was gonna make a comment and I completely forgot what I was gonna say. There was like one thing that stood out to me and I was like, oh, nah, that's okay.
It's all good.
I think you're talking about, sorry, I completely lost track. You're talking about Australia and then...
like the countries, voting.
Voting, yes. Go and vote, people. I referenced John Oliver's Last Week Tonight from about a month ago. And voting is not both a right and a privilege. Voting is a right, and you need to vote.
Absolutely.
Otherwise, like, to me at least, like, your voice is being heard. And so therefore, you know, you're almost considered like a second-class citizen because your voice hasn't been heard in the democratic process, and so therefore you aren't being represented. And so how is anyone supposed to make decisions on your behalf if you don't vote? So,
well said. Couldn't have said it better
Yeah.
myself.
and it, you know, not degrading anyone's, you know, obviously, you know, voting laws in America are very different to Australia, so it makes it very hard to vote.
I
So
think
this-
it's actually a crime if you don't vote in Australia, correct?
It is. You pay a fine, and then you end up having to vote anyway. So, you know, either way, and I think we get basically 95% of the country to vote.
I heard. I heard in one election, it was even 98%. Like, y'all do a great job. We're lucky. Like, I think this most recent presidential election was the
55.
most voted in history. Yeah, and it was some double digits, but nowhere close to 75, if even. We will never meet 100% in this country.
I always think if India can, you know, have their whole country voting, you know, a whole billion of them, you know, 300 million, that's nothing. 25 million, no, that's nothing, you know. It should be, you know, it shouldn't be an issue. And obviously, you know, that's a discussion for another time. Voting. Right. It's very interesting.
So many different things we could talk about on this podcast, Sam.
Yeah, so many. I definitely want to talk about voting next year. Our country's going into a federal election, so we'll get a new, or a different, or maybe a new, or who knows, prime minister.
Prime minister. Oh, that's spicy. See,
and Scotty from marketing, which is one of our various nicknames for Scott Morrison, our prime minister at the moment, has not really lived up to many people's expectations. So we are hoping, and I think some people are very much hoping to roll him. I'm actually hoping that the party he represents realizes how good a job he's doing and replaces him before the election. But I don't know.
Well, I cannot comment on Australian politics, and nor do I necessarily like to. However, what I do like is, and just like with public health, whether it's voting or a health issue, I feel you know, whatever people they take, my job is to give them information that is credible and that they then can take and make their decision. And for me, as long as people participate in the political process and make their voice heard, that's ultimately what matters. You know, there's always caveats to that, and I know that's a pretty large blanket statement. I'm not trying to be Switzerland or neutral on this issue. But yeah, to me, the important thing is that people vote. So
yeah. Awesome. Well, thank you so much for coming on the podcast.
Thank you for having me, Sam.
Yeah. Where can people find you on the internet?
Oh, yes. Well, when I'm not working in public health in my day-to-day life, some of you may have heard that I also host another podcast on the Movie Night Crew Network, and that is my Cabbages, an Avatar podcast about Avatar: The Last Airbender. And you can find us on Twitter, us being myself and my wonderful partner, Zach, who I believe we were both on for a previous episode when we were moving, a topic that I was much less inclined to talk about. But you can find us on Twitter at CabbageCast, or you can, if 140 characters are too much for you, trust me, I get it. You can email us at mycabbagecast@gmail.com.
Awesome. Well, you can find me on Instagram and TikTok at sam.the.journalist and on Twitter at samobjournalist. I also almost forgot to do plugs. I'm going to plug a website called covidlive.com.au. It's an Australian website. I think it was founded by a bunch of kids, but it's got some of the most accurate reporting on percentages, case numbers, where they're coming from. I always find the news gets really, really distracted really quickly. And so having it all in like one centralized place is really good. Especially I go host a radio show and we do like a recap at the start of our show of, you know, the case numbers for the day, and getting that all in one clear spot is very useful.
Well, that is a great plug. I'm going to cheat and I'm going to do two, because I'm going to do a public health one and a personal.
Yeah.
So I mentioned earlier in the podcast who is one of the influences in my life and who really got me into public health, the gentleman by the name of Paul Farmer. I highly suggest people check out Mountains Beyond Mountains by Tracy Kidder. It's the story of Paul Farmer and his nonprofit, Partners in Health. And it is a really good just story, and also background on how like public health is ultimately a social justice issue and an environmental issue, and how like addressing poverty and breaking the poverty cycle is so intrinsically, we would call it in public health. And I didn't try and get into so many jargony words, but we use the word social determinants of health, which basically means all those other things, like, you know, where you live and where you go to school, the things like the food that you have access to, all of these things that are like harder outside of your control, that ultimately impact the decisions that you make every day that culminate into, like, you know, the health and your well-being. And so I think this book does a really good job of presenting that in layman's terms. So highly suggest people read that. And then on the non-public health side, I'm currently reading a really fantastic book for our book club on Movie Night Crew. If people have not yet, you should totally support one of the many podcasts on Movie Night Crew through our Patreons. I know the restricted section has one. My Cabbages has one. Of the Eldest Gods, hopefully of Content and Capable, has one in the future. But you can get on our Discord and join our book club. We're currently reading Project Hail Mary by Andy Weir, and my partner is going to, you know, just, you know, get all tingly and like when he hears me talking about sci-fi, but he's gonna have to listen to the podcast first to hear me plug a book that he recommended, because he's reading it this month. It's really good. It's, as a non-sci-fi lover, I love this book. It's about, you know, an astronaut on a life changing and world, literally humanity saving mission through space, and does not know who he is, what this mission is, or where he even is in space. And it's really interesting. It's very approachable, and I highly recommend.
Wow. Well, thank you so much for coming on the podcast. I'm going to have you on again.
Well, and we can't wait to get you on my Cabbages to talk about some Avatar.
Yep. As of recording, I've just finished university, so I am going to go and get my free trial of... Yeah. I'm going to get my free trial of Paramount Plus so I can binge as much of Avatar as possible.
I know, like, it was not... a goal of yours, but yeah, now for necessity too, binging it will be in your best interest. But thanks so much again for having me, Sam. It's been a pleasure, worries. And I hope you and the rest of the listeners have a great rest of your day. Do yourself a favor, drink some water, and go on a walk. You'll feel better when you do.
Thank you for listening to Content and Capable. You can follow the podcast socials at Content, the letter N, Capable, on Instagram and Twitter. You can send a super boring email to us through contentandcapablepod@gmail.com. The art was done by Opia. You can follow them on opia_art on Instagram. Opia is spelled OPIA. Feel free to message them about making art for your project. Our music was written, recorded, and edited by Nora Strauss-Reeds. You can find Nora at Kane_I, that's I as in the body part, on Instagram and Twitter. Feel free to message her about making music for your project or editing your podcast. I'm proud to be a part of the Movie Night Crew network, which features the restricted section, a chapter-by-chapter Harry Potter pod with lots of spoilers all the time, the Movie Night Crew, join some friends as they react to some terrible, some meh, and some really great movies. Fandoms Gone Wrong, a show that discusses all things fandoms, Of the Eldest Gods, a chapter-by-chapter Rick Riordan pod full of myths and legends, and My Cabbages, an Avatar podcast that follows the true hero of Avatar The Last Airbender, the Cabbage Cart Guy.
Coffee, tea, honor, cabbage. Long ago, the four elements lived in harmony. Then, shit went totally cray when the Avatar attacked. Only the Cabbage Man, merchant of fine cruciferous vegetables, could stand against his trolling. But when the world needed some dank veg, he vanished. 10 years have passed, and my partner and I have started a new podcast.
My Cabbages! An Avatar podcast.
A weekly show about Avatar The Last Airbender. Whether it's Sokka's new line of cologne.
Hey, look at you, sitting there on a seal. Well, now look back at me. I'm on an even bigger seal. Now look away.
D&D related antics.
You have to make an acrobatics check for that, and Aang just like unzips his pants and whips out his d20s. He's just like, I got this.
Or randomly breaking into song.
Go bending waterfall.
We'll stumble our way through the greatest show ever made, one episode at a time.
You can reach us at CabbageCast, which is our Twitter, or
Subscribe wherever you catch pod.
Rotten cabbages? What kind of slum do you think this is?
Content and Capable is a podcast all about answering the question, how do you adult? Don't forget to rate and review it on your favourite podcatcher, and I will see you next Monday for another episode.
That movie sucked.
I kind of liked it.
Movie Night Crew Network.